Assalamu alaikum. I am going to teach you or demonstrate to you the technique of nasal washing and gargling as we recommend in the Allergy and Asthma Institute, Pakistan. We've seen that when a patient washes his nose properly and does gargles after that, it helps to control nasal and respiratory allergies far better than if he's not doing that. The medicines work better, the patient feels better, he doesn't have to avoid any foods or food items which normally would aggravate his illness, and generally it makes a difference in his overall quality of life. A simple thing to do is that you're going to take about half a tumbler of lukewarm water, put in maybe a pinch or two of salt, and then you fill that up in a normal, maybe a 10 or a 20 ml syringe without the needle. And all you have to do is go into the washroom, bend forwards, and gently press the water down so that it goes in from one nostril and out from the other. We're not aiming to squirt it with pressure. We're not aiming to sort of get it up here and be uncomfortable. Just do that, clean your nose, fill it up again, then bring the syringe again and do the other side. Gently allow the water to flow in from one side and flow out from the other. Clean the nose, and with the remaining water in the glass, simply do gargles. But the way to do this, you have to wash the nose first and the gargles come later, and it has to be done as many times as has been prescribed for you. For people with high blood pressure who suffer from hypertension, they should avoid using salt. Another technique which we found is actually far more beneficial than even this is washing the nose with a simple nasal wash bottle called Nasal Wash, which looks something like this. It has been modified according to the requirements in our patients here. All you have to do is simply fill it up to the mark with lukewarm water, clean boiled water preferably, and add in 1 sachet of the special salt which comes in it. With it, this is a pharmaceutical grade salt solution of 2 or 3 different types of salts which clean up the passages without irritating them and give you a tremendous amount of relief. So all you're going to do is fill up this bottle up to the mark, put in 1 sachet of that salt which I just showed you, put it inside, mix it up, then just go into the washroom, bend forwards, and gently press it so that the water flows in from one side and flows out from the other. We're not aiming to squirt hard. Then do it on the other side as well. Press gently, let the water come out, blow your nose, and once again, tumbler of water, lukewarm with salt, and you do your gargles. Ideally, this should be done at least 4 times a day, because less than that, you're accumulating so much of your inhaling pollution, dust, environmental pollutants and things which are going to cause a tremendous amount of mucus production. If you have mucus in your nose and your throat, then if you eat something sour or something greasy, something very cold, it's going to irritate your throat, start making you cough, and also aggravate the asthma. It will also give you a blocked nose. But once you get rid of the mucus, your life will change, your medicines will work better, your inhalers will work better because there's no mucus blocking the chest, your nasal sprays will work better because they can now access the lining of the nose without any dirty mucus hindering it. And God forbid, in case of a severe asthmatic attack, if you do need to use a nebulizer or you're rushed to the hospital, the nebulizer mask will not be able to get the medicine in because there'll be mucus blocking that. So once you get rid of that, I assure you the quality of life, your quality of asthma management will change entirely. But first, remember, it has to be done at least as many times as prescribed by your doctor. I wish you the very best. If you have any questions, feel free to email us or contact us through our website, and just look after yourself and look after your blood pressure. Thank you very much. Godspeed.